Welcome to the Insane Gratitude Podcast. My name is Donis Gil. I'm joined here by Ed Kravitz and Dr. Randy Beck. And we're here today to talk about dementia. And as we were mentioned before, dementia could be a frightening diagnosis for families, but understanding it could be the first step to getting empowered and knowing what to do. Dr. Randy Beck is going to go over the different types of dementia, including defining it and giving us information on how to identify it and whether to know, do you have it or not? Is it something else? So we're going to get right into it. Dr. Beck.
Okay. Thank you, Donis, for the introduction there. Now, so a lot of the stuff that I'm going to talk about today, we also have on the website in a lecture. Not a lecture, just a presentation.
Yes.
If you want to go to insanegratitude.com, you can find the video series there. So you can get a lot of the stuff we're going to talk about today, much more detail if you're interested. Today, we're just going to cover things in a very not in-depth, but casual approach so that we can cover the ground that we have to cover. And I think one of the major questions that we want to answer is, how do I know if one of my loved ones is starting to get dementia? Or is it just normal aging? Or so when should I be concerned? Really, what we want to dig into today a little bit, and we'll touch on why dementia happens or why we think it happens type thing, and then it's just going to be a sort of back and forth casual conversation today. So hopefully everyone enjoys it and everyone will get something out of it. So if you go to the website, the two presentations that are there, one is called Overview of Dementias, Primary, Secondary, and Reversible Classifications. The other one is called Alzheimer's Disease, where we get right into the major cause Alzheimer's disease. So those are the videos that'll be up for this podcast. So you want to go and check those out. That'd be excellent. Now, for this podcast, make sure that, where are we on, Donis? We're on YouTube and...
So we're on all the major podcast platforms. So we're on YouTube mainly, and we're also on Spotify. So wherever you find your podcast, that's where we're at. So we're
excellent.
We're anywhere you want to find us.
I guess for YouTube, if you could like us, that'd be excellent. If you could subscribe, that'd be excellent. I don't know about Spotify and the rest of them. Do they have likes?
They have stuff like that, and you can also share it with your friends. You can rate the podcast too. Our goal is to get this information to as many people that need it as possible.
Excellent. All right. Thank you very much for bringing that in. So basically now we want to talk about what is dementia. So obviously, if you get a diagnosis of dementia, that can be absolutely frightening for everyone, the person involved, the family, everybody. And I know that I think so Ed and Donis both have experiences with people they knew that were diagnosed with dementia. How did you guys feel?
Ed, you can go first.
I felt I was doing great in the world, and then a Mack truck hit me at 100 miles an hour. That's how I felt. Like your world comes to a stop, and you try to figure out a pause and try to use all your resources, all your connections to find a better outcome for your family member. So it happened to me in 2019, right before COVID, October of 19. And I found Charles Werwell had a functional medicine doctor, a few of them. So our family member found one of them, and they went through over $200,000 of treatment and stuff to get to be in a better spot, as they were told they wouldn't recognize their family within a year. And now it's gone 6 years. They recognize their family. They're doing well, but they're still greatly affected. So the idea behind this endeavor was to provide the resources to our family, to other families, so they would have a similar outcome or better outcome.
Excellent.
And from my perspective, I think our outcome wasn't really as positive, but it's also really good to provide people information about how to handle when the outcome doesn't go as well, and what to do, how to get yourself organized, what needs to be set in place as the disease progresses. Also, how to handle certain different situations, such as sundowning and stuff like that when you're dealing with stuff like Alzheimer's. So being able to provide people insight through some of the experiences that people go through would be great. I think we discussed also bringing some other family members that shared in the experience. to share from their perspective, because that might provide some great insight to people who are just starting to go through that process as well, and also provide hope for what's to come later on and how to manage the situation as well. So I'm excited to get into some of those topics.
Excellent. Now, I think the first primary thing that everyone needs to understand is that dementia isn't just memory loss. Memory loss is one of the first things that happens because that's the part of the brain that we notice first, is the memory. However, dementia is actually the loss of function of the nerves in the brain. So a lot of things will be affected. So things like cognitive function, so the ability to think, obviously the ability to remember, or the memory stuff. Also, the reasoning starts to go. So in other words, all of the stuff that happens inside the brain starts to deteriorate. And that's really the devastation of dementia. Okay, the memory is probably the most prominent feature that people will have to deal with, because suddenly your father or your brother or your sister, your loved one, starts to not even know you, and they forget who you are, they forget what they've done, they forget everything in their life. So it's a very devastating thing to happen.
Quick question on that side too, because one of the other things that I saw too is that the short-term memory versus long-term memory, especially at the beginning, because I think, is it true that you start losing short-term memory first, but they still have a pretty vivid long-term memory depending on the condition?
And it's because the place that the short-term memory gets produced is in the lateral part of the brain called the hippocampus. And that is very plastic. In other words, it can change very quickly. And that's how we can make memories. But that's also how we can lose them fast too. So the short-term memory is usually affected first. And long-term memory is stored in various parts of the brain, and then we recall it. So it's the dementia or the brain degeneration has to be widespread before we start losing the long-term, usually. Okay, now, obviously, everybody's brain is a little bit different, and the progression of disease is a little bit different. But what starts to happen is that once we get enough degeneration inside these neurons inside the brain, and we'll talk a little bit later about how that actually happens, how we think it actually happens, and then you'll have a better idea of what's happening inside the loved one's brain that you're concerned about. So we'll move now to talk about, so what actually changes with dementia? So obviously the memory starts to deteriorate. People will forget stuff like languages, especially if they if they were fluent in several languages, they'll start to mix them up, or they'll start to forget one language more than another. Their visual perception will start to change. Their ability to solve problems will start to deteriorate a little bit. Their ability to manage themselves will also start to deteriorate. So they'll basically lose the ability to focus or pay attention also. So it's all the functions of the brain, basically, that as the dementia starts to take hold and you really start to lose neurons, you'll start to notice these changes. Now, these are some of the things we're going to talk later about. When should we be concerned? So if you come home and you notice that your wife is misplacing the keys now and she doesn't remember, she's mixing up the kids' names occasionally and things like that, is that something to be worried about, or is that just normal aging? And one of the main things that we need to look at is, are other aspects of her life being affected other than memory? Because when that starts to happen, so for instance, coordination or her ability to solve problems, those types of things, if that starts to happen, then we need to be a bit concerned. And I think we want to get into, so if we do see these things, are there steps we can take to either prevent them or slow them down or that type of thing? And really, the truth is we don't know just yet. We have a lot of nutritional things we can do. We have exercise and that kind of stuff, which we'll get into later, but if you guys want to.
Yeah, that's the part I'm more excited about too. It's being able to provide some of the things that people could do to either help slow it down or even what to do in the meantime in terms of getting help.
Yeah, exactly. So I guess really what we're pointing out here is that dementia is not the same as age-related cognitive decline, which is going to happen probably to all of us. Age-related cognitive decline will happen to all of us as we start to get older, but it doesn't necessarily mean we have dementia or that we're going to get dementia. It just means that our brains start to change as we age. And that change can sometimes result in changes in certain areas of thinking, memory, information processing, that kind of stuff. So usually intelligence remains unchanged as we age. In fact, sometimes we even get more intelligent. I know that's hard to believe, but that sometimes does happen.
The way that I conceptualize it for kind of computer talk is that the memory or the processing is the thing that's getting slower. So if you think about a computer, your processing speed is decreasing or not as well, but the computer itself is still intact. I don't know if that analogy kind of works or not, but that's how kind of like how I think about it.
It worked for me. I got it. Like you're still smart, but the ability to think or put things together is not intact because it affects all the parts that affect you to put everything together.
Exactly. Now, you just have to remember that not everybody is going to get dementia. We got people in their 90s that have basically no signs of dementia, and they're sharp as a tack. It's just that age is one of the most robust sort of indicators of whether we're going to get dementia or not. So basically, we got about half of all people over the age of 85 have some form of dementia. So that means half don't, which is probably good. We have to look at the old half glass, half full, glass half empty type thing. Now, Ed, with your family member, when they were diagnosed with dementia, did you notice any other changes other than memory?
They had 140 plus IQ, so they had a lot of coping mechanisms. So they went to the doctor and they told the doctor that they had dementia, and the doctor didn't believe them. But after multiple tests, the doctor believed that they had dementia. So actually, it's a family member that self-diagnosed themselves. They had dementia.
There you go. And that's see, the intelligence usually remains. So that's sort of a classic sign right there.
I would also say that's also part of the reason why we're doing this, because if you're aware of what's going on and you can self-diagnose or at least start to recognize some of the signs, at least we can help you put it together and you can be an advocate for yourself when you go get tested or checked out. Because sometimes, depending on the kind of help that you're getting, maybe you're not getting the help that you need, and you need to be a good advocate for yourself. Knowing this type of information is critical for early detection and get into like care that you need.
Absolutely. Yep, absolutely. So good point. Good point. So I'm just going to move on now to, again, what actually is happening in the brain that results in these degenerative type things across a variety of functions inside the brain. So once healthy neurons stop working, or they start losing the connections between them. Remember, the neurons are connected very delicately by these little connections called synapses. And when those synapses start to either degenerate or the information coming in from the axon of the neuron, we'll get into the anatomy later a little bit so that you'll know what I'm talking about. But the neuron body, so if I look at my hand as a neuron, my fingers are like the dendrites and this arm is like the axon that's coming on. So the dendrites are going to hook with other neurons and the axons are going to hook with other neurons. And so they communicate. So my hands and my arms are like two neurons in a row communicating. So if we start to lose this connection here, or we start to lose the ability to transmit information down this axon, we start to have dysfunction in the nervous system. Now, if that dysfunction gets bad enough, then the nerves start losing their ability to do what they're supposed to do. And that's why with dementia, as things deteriorate and more, we start losing more and more function. But one of the first things to go is the memory. And this is, again, the differentiation between primary and secondary dementia is that when the dementia is related specifically to the loss of functions caused by things that we know cause dementia, like Alzheimer's disease or other specific dementias, then that's called primary dementia. Now, secondary dementia is when the neurons start to lose their function of connectivity for other reasons. And those other reasons could be nutritional, they could be heavy metal poisoning, they could be a bunch of other things. Now, the importance is that if you have a secondary dementia, there is the potential that we could actually reverse that and we could turn it around and you could heal if the damage is not as bad as, or depending on how bad the damage is. If it's a primary dementia, then we know you're going down that sort of Alzheimer's type road, and that's harder to treat. So having that understanding between primary and secondary dementia is very important for how you proceed with your treatment, how you proceed with how you manage it. Let's put it that way.
So would secondary dementia be utilizing a functional medicine doctor to see what the trigger is to cause, whether it's heavy metals or inflammation or chronic Lyme or something that could be reversed, versus Alzheimer's disease that might be a lot harder to reverse?
Yeah, that's exactly it. You've summed it up perfectly.
But I've seen where some functional medicine doctors say that they could reverse Alzheimer's disease. Is that true? Or
look, I think it's hard to know sometimes, because it's hard to evaluate what areas have been affected. For instance, they may be able to reverse the memory loss, but what about the other stuff, like the coordination loss, the cognitive, or they may be able to reverse the cognitive function, but not the memory loss. So Alzheimer's is very complex.
okay,
So it's hard to understand. I guess getting back to the basic point of your question is, what is the measurement tool they're using to decide where the person is in the process, and then how they have either reversed it or slowed it down or whatever. Now, we have in the Institute of Functional Neuroscience, where
by different treatments, but by hyperbaric chamber, UV sauna, or other things. But
there's all kinds of treatments you can use,
or laser therapy. Yeah.
Where people have shown some improvement in various aspects.
Okay.
So we have to now go, okay, even the diagnosis of Alzheimer's is very hard sometimes to actually establish.
To me also, it's making sure that people know what their options are. So knowing that differentiation between primary, secondary, and even what specific type of secondary or primary dementia is happening is going to be critical for what are going to be the treatment approaches, how are we going to approach maybe slowing down the disease or managing it in the meantime. So that's key in terms of knowing how to advocate for yourself, like I mentioned earlier.
Absolutely. So I think if you were concerned, like for instance, in the example that I just used about I came home and my wife was misplacing the keys and she was forgetting the kids' names and things like that. First thing you want to do is establish, is there a secondary cause? So you need to go and get a full physical exam, get your blood test done, get all that stuff done. Rule out if there is any secondary cause, first of all. And if that and while you're doing that, then you can go in and get the physical or the nutritional stuff, the physical exercise, nutrition, get all that stuff up so that you're putting yourself in your best position to fight any kind of, whether it's a secondary or primary. You want to have your body in the best shape it can be to fight whatever it is.
You want to optimize the nutrition, you want to optimize the things that you're doing, sleep specifically too, because even sleep, some people are saying sleep alone can mimic some of the dementia symptoms. So optimizing that may clear up some of those early fog symptoms as well.
What I was going to ask was, since I missed part of it, was when you go to your primary care doctor, Dr. Beck, most of them just give you the pill to take care of dementia. They don't look at a lot of the secondary causes of dementia. Versus if you went to a functional medicine doctor, they look at the whole person, like you said. So the whole goal here is also to list all different types of functional medicine doctors around the country and the world that treat primary versus secondary dementia, outside the box approaches to help those people, like my family member, so they could have a better outcome, and list those as a resource, right, Donis, on the website?
Right. So our goal is to start populating the site. So we're going to start with some of the ones that we're aware of and that we're known and familiar with. But if you are a functional medicine doctor yourself as well, feel free to reach out. We would love to feature you on the site as well, because we want to make sure that people are getting access to as many qualified doctors and clinicians available. But even from the other perspective, at least by learning the information, you can properly vet whether or not the person that you're working with, whether they're a functional medicine doctor or not, can provide you with the best treatment possible. So this is the whole goal of a lot of this information stuff, is to make sure that you are properly educated and what to look for and the questions to ask while you're in there as well.
100%. Absolutely. And you just have to also remember, doctors are people too. Not perfect. We try to do our best all the time, but sometimes we miss something, or we have not been told everything, or we don't have the tests that everyone thinks we have. We try to get the decisions up as best we can, but then again, second opinions are absolutely necessary sometimes.
And it's a team approach. So
Yes.
the whole goal is not to point out people's insufficiency. It's more to make sure that everyone's as educated as possible, so that you can, one, advocate for yourself, two, you can have an open conversation with your care provider and make sure that everyone's on the same place and you're coming up with the best plan possible for your particular situation. Because specifically I'm not saying that this happens a lot, but there's occasions where people fall into the default treatment. So you want to make sure that you're not falling into whatever default treatment it's happening. This is a way to vet and have a conversation openly with your provider in terms of what you're looking for, setting expectations, and knowing what's available for you to look into to get the best results you can.
Oh, wonderful advice. Absolutely. Perfect. Now, Ed, do you have anything to add to that?
No, it's just, like I said before, it's better to know whether you're dealing with a primary doctor versus functional medicine doctor. And if you have primary or secondary, like the key takeaway points. And if you're able to reverse it or slow down the progression of it, to enjoy your family members, make as many memories as possible with your family. That's the ultimate goal. And to provide the people resources to be able to do the same.
Absolutely. Okay, now getting back to the symptoms of memory-related mature cognitive loss, the cognitive loss of memory that happens basically as a course of aging. The main sort of distinction is that it doesn't really, you may forget things occasionally. You may cause a bit of embarrassing situations because you can't remember someone's name or whatever, but it doesn't interfere significantly with your ability to handle daily activities. That's the differentiation. When you fall below that, when it starts to actually matter, for instance, that you can't prepare dinner for your family or whatever because you forgot or whatever, that type of stuff is crossing the line into interfering with your ability to handle everyday life or function of everyday activities. So that's the line that you have to watch for. If that memory loss starts to, or the difficulty in planning, or the frequency of misplacing things, or forgetting conversations or events starts to actually affect your daily life, that's when you have to really start getting concerned and getting out and taking action, going and finding a provider, whatever provider you feel can provide you with the care you need. First of all, the differentiation between primary and secondary, very important, I think, because someone just defaults you to the Alzheimer's, for instance, Alzheimer's medication, and that's not what you have, you may be missing a very narrow window of being able to reverse that if it was a secondary cause that hasn't been diagnosed yet. That's the danger of just falling into the average treatment box, as Donis was saying.
Yeah. And I think that's key because that's where the opportunity is to make a big change and make a difference. And like you said before, it's not the doctor's fault. It's sometimes maybe not getting all the right information at the time. But the goal of what we're doing here is to make sure that we're providing the resources so that you have all the information you need to get the right diagnosis and get the help at the proper time that you need it so that you have your best chance to either reverse if it's a secondary or at least slow down the cognitive decline.
Absolutely. Perfect. And this is a graph that kind of demonstrates what I was just saying, was that once you pass a certain point, your deterioration will happen very quickly. And so you want to get, if there's any kind of intervention, you want to get it done back here in this yellow area before we hit the blue downward heading arrow. Because once we hit this accelerated thing, this is very devastating in people's lives.
Kind of like the point of no return.
Exactly. So we want to get everybody we can back here. If there is a way of reversing things or a way of preventing the progression, this is where we want to get them back here.
In that yellow area, like our family member, they were going to go through a trial or do some things, and their functional medicine doctor and another doctor both concurred that some of the things our family member was considering was going to hurt them or make them worse. So I think also finding the right person to be able to tell you if you're looking at a trial or you're looking at a treatment approach, is that okay for you to take? Are you going to be okay? Because some of those treatments are pretty aggressive compared to normal traditional medicine. And if you go to your doctor, like your primary doctor, and you tell them that you're going to go see a functional medicine doctor, and they say there's no clinical trial or something like that, but a lot of them, the primary care doctors are bought out by the pharmaceutical industry to just push a pill. And not everybody fits into that box. And our goal is to try to solve that problem to help as many people.
Absolutely, 100%. And even the drugs that are available are not necessarily that effective at managing all the stuff that's happening inside the brain. So really, if you get to the point where you're requiring medication for Alzheimer's, you're starting to approach this blue area here.
Yeah.
And there's not a lot of, as you can see, there's not a lot of hope once you're in that area. You can slow things down sometimes. Reversing it is difficult or impossible at some point because you've lost too many connections in your brain. This is where we want to continue doing research, continue doing all the stuff that is happening to find something that maybe will work. And a lot of the functional approaches, like the obviously nutritional approaches, other approaches like using direct current stimulus across the brain or laser stimulus across the brain, these are all things that are being used right now, but the outcomes of those are not conclusive yet. Although we do see results in a lot of people, it's not something that has been approved by the FDA or anything like that for Alzheimer's. So we're still in the experimental phase. We want to try and keep people out of that blue area as much as possible. Obviously, the red area is right out of the question. We don't want you in that red area at all.
Is it possible for laser to help regrow neurons in the brain, like for spinal cord patients where they're able to walk again with laser therapy?
Yeah, that's the hope of laser, is that it does a few things that we know from our sort of investigations. it increases the amount of ATP that are produced. So ATP is the energy inside the neuron that it uses to do things. So if you don't have enough ATP, your neurons can't function the way they're supposed to, and they start to degenerate. So that's one of the hopes of laser with something like Alzheimer's, is that it can supply the energy that might not be there for some reason for the nerves to regenerate, or to at least slow down the progression. So laser is one thing. The other thing is using some currents or magnetic pulses to, remember I talked about those dendrites that connect things together. So the magnetic pulses and the direct currents, they help those dendrites to reestablish connections. So we're trying to use those to apply them in the dementia area. Now, there's a lot of research into this now. There's just not enough conclusive stuff yet for me to be able to say conclusively, get out and do these things. Now, you can try them, absolutely. If you're in a situation that you want to do everything you can to prevent, so for instance, you're in a mild cognitive decline or a mild memory impairment situation, or you've had an injury, and you want to minimize the likelihood that's going to result in some kind of movement towards dementia, you might want to try these things. There is some pretty good evidence that it will help you. Okay, so now again, let's just review again. The primary dementias are caused by neurodegenerative diseases, where dementia is the primary illness. So things like Alzheimer's disease, frontal temporal dementia, frontal temporal lobar degeneration, those are the sort of big three medical dementias. Now, we have secondary things that can also result in decline of neurons. For instance, multiple sclerosis, meningitis. Now, obviously, meningitis we can treat with some antibiotics and things like that. Multiple sclerosis is another sort of disease that is, a lot of research is being done in that area, but whether we have a conclusive go-to for that can be debated. And I don't think this is the time or the place for that. I think that that's just showing that secondary dementias can be treated. And most of the time there is a little bit of a narrow window, so we don't want to waste that opportunity by not getting that diagnosed. And a perfect example of reversible dementia is a thing like normal pressure hydrocephalus, where for some reason our pressure inside our brain gets too much and it starts to interfere with the function of the neurons. And that can be relieved by installing a shunt or some other way to relieve that pressure. And then usually that damage will reverse. So there's a perfect example of reversible dementia right there. Now, what I was going to do now is just move into sort of what kind of stuff happens to these neurons. Just give you a little bit of a picture to show you what's going on with these, mostly Alzheimer's, but the primary dementias. So we have some things that we found in the research. So we start to get these neurofibrillary tangles inside their neuron. And we also start getting these amyloid plaques developing outside the neuron in the cytoplasm. So inside the neuron, remember I was talking about the thing called the axon? Okay, so let me go back and review the anatomy here. These little twigs coming off, these are the dendrites. This is the nucleus of the neuron. This is the sort of cell body of the neuron. And this is the axon that's going down to communicate with other dendrites in another axon down the chain. So in this axon, lots of things happen. So one of the first things that has to happen in this axon is that neurotransmitters get produced here in the cell body, and they get transferred down the axon, and then they get released here. And those neurotransmitters are what communicate with those dendrites on the other side. Now, in order to get from here down to here, the neurotransmitters have a transport system. It's not as developed as Amazon's, but it's a transport system. Okay, inside the neuron. And they use things called microtubules to move they're just like a conveyor belt basically for the neurotransmitters. And if I just go to the next slide here. So what you'll see is these are the normal healthy microtubules. And they're stabilized by a protein called TAU. I know it's a funny name, but that's what it is. That's the name it got. Now, if that tau becomes unstable for some reason, then the microtubules start to become unstable, and then they form these tangles. And that's what we call neurofibrillary tangles inside the neuron. But it's caused by this tau protein becoming unstable. And then these tau proteins tend to bind together, and then the neuron will eject them, and then they'll be out in the cytoplasm. And that's when you see the amyloid plaques developing from these tangles of proteins. At least that's what we think is happening in Alzheimer's. So basically, the neuron loses its ability to communicate because it can't send the components it needs up and down the axon to communicate with other cells. So then it becomes basically, instead of a neuron, it just becomes a cell that can't communicate. And
So basically, all the delivery people are going on strike.
That's right. So all the people that, all the drones and everything that are delivering the Amazon stuff, they've decided they're not going to work anymore. So your package doesn't get there.
Yep.
And then sooner or later, you get mad and you cancel your order, and then Amazon goes, right.
That's a pretty good analogy.
What's happening inside your nervous system.
Yeah.
And then obviously we look here, this is just showing some of remember I mentioned that thing called the hippocampus, which is where the short-term memory happens. That's this sort of whole sort of apparatus here in the lateral aspect of the brain here. And this area of the brain is very plastic. So what that means is it's very open to change. So those dendrites are very flexible, changing things that can change between neurons, and the strength of them can change very quickly. So they can form memories. Basically, what a memory is, a neuron circuit that has formed to maintain that information. And then that information usually gets distributed across the brain. And once it gets distributed across the brain in other locations, then it becomes a long-term memory, pretty much, is what we think happens for memory. Now, remember, a lot of the stuff we're talking about there is no 100% understanding of all this stuff. We're getting there. Every year that goes by, we learn a bit more. Our understanding increases, but we're still not completely understanding the brain and the nervous system so that we can say with certainty, this is what's happening. Even in Alzheimer's, yes, we see the tau protein, we see the neurofibrillary tangles, that kind of stuff happening. We don't actually know for sure if that's what's causing the Alzheimer's. We're predicting and we're projecting that's what's happening. But it's just that is there in people with Alzheimer's, so we are saying, okay, that's probably causing it. Now, somebody once told me, if you saw an elephant that was dead and you saw these birds going around, these vultures circling the elephant, and you didn't know any better, what would you think? You would think the vultures killed the elephant, which isn't what happened. So that's one of the dangers of jumping and making conclusions and projecting things without absolute understanding.
So understanding that may not have been the cause, that could just be the result from something else that caused it in the first place.
Yeah. Absolutely. And so that's why when we're doing the research and we're developing the drugs that we've developed to fix these types of things don't work in everybody. So there's obviously something else going on that we don't know about. Because the drugs that fix the neurofibrillary tangles and that destruction of the tau and all that stuff still don't work in everybody with Alzheimer's. So there's other stuff happening that we don't understand.
So I have maybe two questions. With like when they figure that like boxing developed CTE, like a cause and effect. And now they have, or they say for years, we're having biomarkers in the brain that determine concussion and memory and other stuff. When people die with Alzheimer's or some memory loss, if they donate their brain to research, are they able to use biomarkers in the brain to see what percentage of their brain was made up of certain properties to be able to develop better drugs or better treatment to solve the problem? Or like I did like backwards design. I was just trying, like in education, I was just trying to.
Right. Now, there's a huge area of research specifically looking at that. Now, the one major problem, obviously, is that when someone is dead, the brain isn't working. And a lot of these markers are proteins that are made when the brain is working.
Okay.
So it's hard sometimes to extrapolate from a dead tissue to a live tissue in that respect. But the research is happening, and there's some good stuff coming up. And as long as our understanding keeps improving, then I recommend everybody progress and keep doing the research in the line that they're trying to do, so that we get more information. And the more information we have, obviously, the better everything is. But it would seem logical that if you had somebody who had Alzheimer's and you took their brain and you examined it, you could determine how that's different from somebody who didn't have Alzheimer's. And then say, okay, that's probably the result of the Alzheimer's, or potentially that's what caused it. Just like Donis was saying, we don't really know if it's a cause and effect situation or an effect and a cause situation.
Yeah, but when in case of what Ed was talking about before, that there is damage. So I think figuring out what's causing the damage is what may lead to probably eventually finding a working solution. That's why I'm a big fan of some of the stuff that's been coming out, where some of the research is talking about adjusting like your nutrition, maybe adjusting your use of your brain, because similar to how your muscles, if you don't use your muscles, they start to deteriorate. So if you're not using your brain as much, or you're spending your time doing like low cognitive activities, then you start to slowly deteriorate over time. So I'm excited to kind of learn more about some of those things.
Yeah, absolutely.
Going forward.
And I think what we will probably do is dedicate a few other podcasts specifically to that, because I know this one is starting to stretch out now. So I think we got to start winding this down. But look, hopefully it's been something that has produced some information for people and allowed them an understanding maybe of what's happening in their brain with the primary and secondary approaches to understanding what's going on, and help them understand to differentiate and when to take action if they start to notice a loved one is losing their memory, or maybe not as bright and as onto or on point as they used to be, and when to take action and go and do further investigations on that. And as we move through more podcasts, we hope to get into that in much more detail. That's my hope. And I'm sure that's your guys' hope too.
Yeah, and some of the stuff getting into it, obviously we have to get into the information part and recognizing what we're facing first, which may not sound as fun in terms of discussion, but we have to know first what we're dealing with, how to identify it, and what options we have available, because then going forward, we'll get into more of the stuff that we can do to either protect yourself, or either get the best care that you can get, or just inform yourself on how to take the steps that you need to take to get the best outcome possible.
Absolutely, 100%. And so I think that's the promotion for the next podcast, is that we're going to be getting into some of those things in much more detail. So hopefully everyone will come back and join us for those as we get into things that are more fun to discuss than the stuff that we talked about today. But the stuff we talked about today is pretty important, and as you're moving forward in the understanding of what's going on with you and what's going on with your loved one, and getting a diagnosis. And then once you have that, then understanding what your options are. That's where we're going to be going with the podcast, That's what we've talked about anyway. Let's put it that way.
Yep.
That's perfect.
Excellent. So everybody, we'll leave it at that today, and then we'll catch everybody in the next one.
Yeah, and just a quick reminder, Dr. Beck said at the beginning, please make sure you take the time to check out the Insane Gratitude website, insanegratitude.com. We have all these resources available to you guys there, and we look forward to seeing you guys in the next one.
Excellent. Any parting words, Ed?
No, I think this was amazing. A great flow, great chemistry, and we're just getting great information out to help as many people and help the world navigate dementia.